The topic I'd like to speak to tonight is about depression. And I think depression comes in many forms, and as we've talked about before, it affects different people in different ways. And it's unfortunate when many people hear the word depression, or somebody tells them that they're depressed, they automatically think, well, they're feeling sorry for themselves, or snap out of it, all of those cliches that people say. But I'd like to mention that it's not that simple, especially for the one that is depressed. It's interesting that it's a chemical imbalance of some sort. Now, I'm not an expert on the subject of that, and I certainly don't want to mention or talk about how that could be or it couldn't be, but irregardless, it's something that a lot of times just can't be changed. It's something that's there, and it has to be dealt with. And I find that dealing with depression is very difficult because you never know when it's going to strike, and you never know what is going to set it off, or really what the cause might be. Sometimes you're going along pretty good in life, and then all of a sudden you get these feelings that you just can't get rid of, and it takes time to work through them. Again, man, everybody is different when it comes to depression. And of course, if you're dealing with a tragic event in your life, then that's understandable that you're going to be depressed. But clinical depression is something totally different. And again, I'm not here to talk about medications that you might find that work, or that I have found that work. It's not about that. That's a personal decision, and that's something you should talk about with your doctors and your family teams. But obviously, medication can help and does help, and I'm well aware of that. But some of the things that we can do is, well, obviously sometimes the only thing you can do is write it out. And whether you have to spend a day or two at home, and you're taking lots of naps, because I know myself, when I'm depressed, I get very tired, and I find it very hard to even keep my eyes open. So I find that napping throughout the day really helps, and sometimes just that 15 or 20 minutes can make all the difference. But depression is a lot deeper than that too, isn't it? It's something that sometimes when you think about what's going on in your life, and maybe there's a situation that you can't control, you're depressed. But as I mentioned too, sometimes you don't know at all what's going on. You just have these feelings of worthlessness, and you can really get down on yourself. Now, again, I mentioned that some people think, well, you're feeling sorry for yourself, and I don't agree with that at all. It's totally different being down on yourself, because it's not something that you're doing automatically. It's something, it's your body telling you that you need to rest. And so I think that's the big thing. It's not about sitting around and feeling sorry for yourself, although there might be times when you do that too. But again, depression is a lot deeper than that. And I've found over the years that what works for me, as I mentioned, resting. There's things you can do too, like you can exercise. And sometimes you have to do something to distract yourself, to take your mind off the depression. But as far as what works for you, or maybe you're looking for something, and again, I would encourage you to talk to a health professional that can give you a little bit more better advice, because there are solutions. And I'm here to tell you that, not every solution works. For me, it might work for you. And, we shouldn't be telling other people, well, this won't work for you, or don't try this. I mean, you don't really know if it's going to work until you give it a try. So, with that being said, depression is one of those leading causes of many different problems, and there's lots of people that deal with it in many different ways. And what causes it can be completely different as well. So if you can at all find out what works for you, then that's really the best thing. And I'm not here to, again, wave a magic wand and say, well, I have an absolute solution for it, but I'm just here to talk about what happened, what I do to get through it. And I want to emphasize that, if you're going through a depression, if it's something that's just new to you, and you don't know where to turn, or sometimes it does feel like that there is nowhere to turn, or maybe you feel like you don't need to go on. Those feelings are normal, and it doesn't mean that you have to do anything drastic, but there is help available. And I've had a lot of those issues in my life, and I have found solutions. But then it's interesting too, a few days later, or months, or whatever it might be, those depressive feelings come back. So it may be something that you have to battle the rest of your life. But the important thing is to be able to work through it. At least that's what I've found. And, to go to people that your friends, or somebody that you can talk to, is a big help. And, avoid people that say things like that, oh, you're just faking it, or all of those, again, cliches that people say. It's very sad when others treat you like that, and try to make you feel that it's all in your head, so to speak. I mean, it may very well be in your head, these chemical imbalances that cause depression. There are other factors too, but these things that come up in our lives are not always the easiest to deal with. So I've been rambling on here now for a few minutes about depression, but I guess my main message tonight is just to say, well, there are solutions, and there are people that you can turn to, and don't give up. And that's not going to just maybe happen overnight. You're not going to find maybe the right medication, or the right doctor. In fact, these things might take years. And I've certainly have seen that, because sometimes doctors have their own thoughts and their own medications they prescribe, and you have to kind of just self-diagnose yourself when something works or doesn't work. And you need to be able to tell your doctor what is working and what's not working, and hopefully you can work through those problems. But if you can find somebody to talk to, again, a family member or a close friend that is caring and does understand you and doesn't try to belittle you, that's can be a big help as well. So, in these times we live in, it can be very depressing and stressful. And I'm sure stress leads to depression as well. It could be, a contributing factor, and that's something that, all of us are going to continue to deal with throughout our lives. So hopefully, if you find yourself struggling with depression, I urge you to get help from, a number of sources, again, whether it be a doctor or a family friend. So thanks for listening to me tonight, and I hope that my words have comforted you, and we'll talk again.